Good evening, and this is In the Public Interest, and this evening I am your hostess, Linda Johnson, and my guest this evening is Dr. Charles B. SImone.
Hello, Linda.
Welcome, Dr.
Thank
SImone.
you.
Listen, I'm very, very excited about tonight's topic, how to reduce America's runaway health care costs. Now, first of all, I want to preface this by saying you have written a paper or you're going to present because President-elect Obama has called for an open forum on health care. Is that correct?
That's right. That's right. And our paper, our concept is quite unique, and I think we'll get to the point of what's going on. We need to reduce the runaway health care costs, and the problem is spending on health care in the United States now will double by the year 2017. It'll reach $4.3 trillion. That's a whole lot of money.
A lot.
And it will account for nearly 20% of America's gross domestic product. That's a huge portion of all of our dollars spent in America. Despite spending the most on health care in the whole world, the United States ranks last out of 19 industrialized countries.
Wow.
Last. We spend the most on health care, and we're ranked last.
Unbelievable.
It is.
And we have some of the best people here.
We have the best people, but we're not doing it right.
Okay.
And we have one of the highest infant mortality rates in the whole world. What we know is 1 in 2 men and 1 in 3 women will get cancer in this country, and 2 in 5 Americans will get cardiovascular disease, and 1 in 6 Americans will get diabetes. These numbers are astounding. We know that we've seen little progress in treatment, and here's the problem. Against the background of this ever upward spiraling health care costs, we have seen surprisingly little progress in the treatment of combating these major illnesses. Our primary focus on treatment, with minimal attention to prevention, has created this cost-explosive situation that will grow exponentially. Our losing war against cancer eliminates this grave challenge. Despite the hundreds of billions of dollars spent on cancer research and treatments over the decades, the number of new cases of every type of cancer has increased. Despite the introduction of expensive treatments like radiation, chemotherapy, surgery, immunotherapy, despite all the billions spent on CT scans, PET scans, MRI scans, despite all that, we have made lifespans for almost every adult type of cancer has remained the same since 1920.
You know, Dr. SImone, you just hit on something, and we always talk about prevention every time you're here. And anybody that has ever listened in on the show knows that you are a champion of prevention. But we know prevention is urgent.
Yes.
But what exactly do you define prevention as being?
That's important to know because many groups of people talk about prevention and not mean prevention, they mean detection. We have to talk and concern ourselves about true prevention. How can we do something to prevent a problem? Not detection, not like a mammogram. Mammogram is detection, but often logged in a line item as prevention. It's not the case. We need to do prevention. Prevention is not readily popular. It takes a lot of responsibility on the individual and even on the shoulders of the government. It's not a popular thing to do. Very few dollars are assigned to prevention programs. We have one of the first programs in the nation, the Kid Start Prevention Program.
I was going to mention the Kid Start program. That's where we start with the kids really young.
Oh, when they're little tots.
Yeah.
And that's how you have to do it. You have to start
starting with a
program.
healthy lifestyle.
And we'll talk about the prevention program on the second half. But because it's not very popular, we still need to do this. Strict genetics have little to do with chronic illnesses, including cancer. Only about 5 to 7% of cancers are related to genetics. So just because mom and dad had cancer doesn't mean you'll have the cancer either. And we know that nutritional factors account for 60% of women's cancers and 40% of men's cancers and 80% of cardiovascular disease. So we can prevent problems. Another 30% of cancers are caused by tobacco. These and other risk factors that we can control account for 95% of all of our chronic illnesses. So genetics has a small role to play, so we have total control over these prevention factors. This continuing de-emphasis on causative factors with a growing emphasis on treatment is the root contradiction in American life that must be addressed before healthcare costs can be contained. Since 95% of all chronic illnesses are preventable, it's very clear that Americans can live longer, happier, healthier, if we reduce their risk factors. Not just contain, but we can lower the cost. If people elect to modify their risk factors, we can lower the cost dramatically very, very quickly. Today, a person who is healthy and constantly modifying his or her risk factors is actually subsidizing a person who does nothing about changing their lifestyle and goes through life deciding to, and choosing not to change their lifestyle when they can, when they can help themselves. What we need is a program that focuses on the average person's disease risk factors and then provides an incentive to modify these factors.
So when you say disease risk factors, might I have a different risk factor of a certain disease than perhaps you?
Sure. One of which is, say, nutrition. It's a common denominator, but you may be eating more fats than me.
Okay.
You may be eating less vitamins and minerals, taking less vitamins and minerals than me. These are controllable risk factors. These risk factors will have an actual positive or negative input on your overall life.
Okay.
And that's what we'll expand on soon.
Okay.
Now, what we did is in 1993, we applied in the United States Patent Office for a patent and finally obtained the patent in 2008. And we call it the SImone Health Advantage. And what this does, this patent will be able to reduce healthcare costs in this nation for companies, organizations, unions, and even governments at all levels. This health advantage, the SImone Health Advantage, will provide financial incentives to employees and their families to modify their lifestyles to become optimally healthy. So we will help people, encourage them to become healthy.
By providing these incentives.
Right.
It only makes sense.
Well, it's fair because for years and years and decades, car and life insurance companies' premiums have been already linked to risk. In other words, if you drive a car and have 10 accidents a year, you're going to pay more premium than the next guy who doesn't have any.
Exactly.
And the same way with life insurance. Now, for the first time, the SImone Health Advantage will link healthcare premiums to the risk factors of the patient.
And I guess it would be a win-win situation.
Wins. Everybody wins.
We win as a
we
group.
become healthier.
We become healthier.
We have a higher self-esteem.
Employer costs.
Employer costs are down.
Everything.
It's overall, it's going to be a voluntary program, but there's no other way to reduce healthcare costs. Employers can offer this to all, and participation will be totally voluntary. Employees who modify the risk factors will have fewer sick days, greater energy and productivity, and better self-esteem, and a lower risk for disease for themselves and their families, because they're going to bring this information to their homes, and their children will benefit from it. That's what the key is. And over a period of time, they will be a less of a burden to the healthcare system in our nation, because they're going to become healthier every week, every month, every year.
And you know, Dr. SImone, sitting here and I'm listening to what you're saying about the SImone Health Advantage, and the very first thing I think about, because I always think about smoking, because, my goodness gracious, talk about it, that is truly a choice.
You're right.
That's a choice. And so that would be included, too.
And eating the hamburger is a choice, as
That's
opposed
right.
to a soy burger
or a turkey burger.
Turkey burger, rather, yeah.
Very good.
Exactly. So we have choices all the time, but sometimes because of lack of education, we may choose the wrong one. Our program is going to help educate people and put them on the right track. And these dollars that we save now, we know that 50% of all Americans believe that providing incentives will actually do the job. So people are expecting to be rewarded for good behavior. So we can do that. We can help them because that's what Americans are looking for right now. The great majority of Americans surveyed are convinced that financial incentives are far more powerful than preventive counseling measures in influencing your personal health behavior. Employers now will have immediate advantage. They'll save more, It'll allow them to keep more jobs in the United States instead of outsourcing. It'll create more jobs here. They'll be able to do more research and development here in the United States, and they'll be able to expand. And all for the good of their business and especially America.
Because it's going to help with productivity,
That's right.
less absenteeism, etc.
Right.
Okay, well, listen, we're going to take a break.
Okay.
What you have just said has just been eye-opening. Of course, we've always heard you talk about prevention, but we're going to take a break. But when we come back, we're going to expand a little bit more on prevention and how we can begin, like you mentioned, the Kids Start program, etc.
Great.
This is WING AM 1300 and WZBN Channel 25. And of course, you can always find us on the World Wide Web at WING AM1300.com. We'll be right back.